Hey guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before starting with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, and videos to assist nurses as well as nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I would love to assist you as well if needed. Now, my disclaimer and reminder is that we know there's no absolutes in medicine, right? We treat on a patient by patient basis, and any of these questions that you see, I have created and designed based on the guidelines that are currently being tested on the ANCC as well as AAMP exam. Now, any of my videos, if I'm teaching on anything that we currently do in practice, I will always say that so there's no confusion. But with that being said, let's get into question number one for today. Question number one states the patient has been diagnosed with latent TB. What is the best treatment option? Is it A, INH and ethambutol? Is it B, INH? Is it C, INH, rifampin and ethambutol? Or is it D, INH, rifampin, ethambutol, and pyrazidamide? Take a moment and tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first so it allows you to slow down and ensure that you're answering what is being asked. So, here the stem of the question states, what is the best treatment option? So, I always tell you if it's asking for a treatment, you need to run it back and see what the diagnosis is, right? So, here they have already provided the diagnosis. The diagnosis here is latent phase TB, right? So, the latent phase of tuberculosis. So, how do we treat the latent phase? And this is a knowledge style question, but the best answer here is C with those three therapies, the INH, rifampin, and ethambutol. Now, remember, and I always tell y'all, if there are various ways to treat something, make sure you know it and make sure you're paying attention to the various terminology. And what do I mean by that? With tuberculosis, you can have the active phase or you can have the latent phase. Active is where they are symptomatic, their PPD is positive, their chest X-ray and or sputum culture is positive as well, confirming an active diagnosis. And so we treat with all four for that, right? And that means they are contagious, so you want to quarantine those patients. Now, with latent phase, they can have the positive PPD, but the confirmatory, gold standard diagnostics exams of like the chest x-ray and or sputum culture will be negative. So these patients are not contagious. They do not need to quarantine, but we still do treat. And so you treat them with the INH, rifampin, and ethambutol, okay? Question number two, the nurse practitioner and NP student are discussing Celexa in the elderly population. All of the following regarding the use of Celexa in the elderly is correct, except is it A, review medications as there are many listed drug interactions? B, monitor the EKG due to risk for QT prolongation? C, do not exceed a dosage of 20 milligrams daily for patients 60 years of age and older. Or D, do not exceed a dosage of 15 milligrams daily for patients 65 years of age and older. Take a moment and tell me what you got, you guys. All right, so stem the question states all of the following regarding the use of Celexa in the elderly is correct, except. So remember, this is a prime reason, I always stress this about reading the stem of the question first because you don't want to miss those absolute terms like not, except, initial, best, first, you know what I mean? So here, we're looking for the incorrect answer, right? Because it says except, all are correct except. So we're talking about Celexa in the elderly population. So you need to know those things that we need to watch out for, those contraindications, how to prescribe and utilize these in the elderly, right? So A, would you review the medications as there are many listed drug interactions? That's true. Although Celexa is one of those safer medicines for the elderly population, um, for the management of depression commonly, it also is one of those you have to watch because they have many listed drug interactions, okay? B, do you monitor an EKG due to risk for QT prolongation? Yes. Celexa is also known for the potential risk of QT prolongation, so you do want to monitor their heart rhythm to make sure that there's not any prolongation noted. C, do not exceed a dosage of 20 milligrams daily for patients 60 years of age and older. That's also correct. In the elderly population, you do not want to exceed that 20 milligrams. If they are 60 years of age and older, you do not exceed the dose of 60 milligrams daily, okay? Now, so the incorrect answer is D. So D is the answer choice because 15 milligrams is not correct, okay? All right, and question number three. The nurse practitioner and NP student are discussing contraindications of calcium channel blockers. All of the following are contraindications of calcium channel blockers, except is it A, hypotension, B, angina, C, heart block, or D, heart failure with a reduced ejection fraction? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question states all of the following are contraindications for calcium channel blockers, except. So we're looking again for the one that's incorrect. So knowing those contraindications and which one is not a contraindication of those calcium channel blockers, right? So hypotension, yeah, we know that we typically use calcium channel blockers for hypertension, right? So that must mean that it aids in lowering the blood pressure. So of course, we don't want to give it to somebody who is hypotensive. So you can scratch A because we know that is a contraindication. B, angina. B is your best answer choice here because angina is not a contraindication of calcium channel blockers. Calcium channel blockers, although we use it for hypertension, it also can be utilized for angina because it helps with the oxygenation, which can relieve that chest pain. Okay, so sometimes you will notice that people will give you a calcium channel blocker to assist with angina. And then AV heart block is, especially second and third degree, are contraindications of calcium channel blockers. And a heart failure with a reduced ejection fraction is also a contraindication of calcium channel blockers. So I wanted to give you some farm today. You know, I've told you I'm gonna start throwing some of these in to kind of help you because I get a lot of y'all reaching out about understanding those first and second lines, understanding things that's contraindicated, understanding different uses of these medicines, and retaining it. So I will continue to incorporate these to hopefully help you retain it and study. So I hope you found this helpful. But as always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. And if you need any of the resources that I offer, feel free to contact the Nursing Studio at 803 400 6864. You can also shoot a text message to that number, or you can shoot an email to the nursing studio, the number one at gmail.com. I offer my review book that is either an ebook option or a paperback option. Both are linked in the bio of this channel. Also, there is a self-paced review that's broken down by systems. It is designed for family and adult general nurse practitioners preparing for the ANCC as well as AANP exam. That is also linked in the bio of this channel. My 5-week review course is a group intensive review for family and adult general, and that is linked in the description of this video. And then my one-on-one sessions that are designed either for weaknesses that you want to work on, if you want to assess your exam readiness, or if you need to structure your study over a longer custom duration based off of an unsuccessful attempt, and you're needing someone and to guide you, restructure your studies and work alongside with you. I do those sessions and help guide you from being unsuccessful to successful. So I always say with the one-on-one sessions, please reach out and call or email so that we can gauge what you really need and get things set up for you. Okay. So again, if you need me, you know how to reach me, but y'all know what to do. Make sure you meet me back here. And as always, happy studying. Bye, y'all.